anyone here familiar with the term cannabis? Let me give you its broad meaning. Cannabis, another name for marijuana, is considered to be a tall herb that has a tough fiber and is often separated into a tall, loosely branched species and low-growing dense species used to cultivate varieties of high-level THC. So what is cannabis oil? Cannabis oil is a thick substance made of cannabinoids, which are removed from the cannabis plant. You might have heard cannabis oil called a few of these names, such as marijuana oil, THC oil, CBD oil, hemp oil, and hash oil. As you can probably tell, the different names can be confusing. It's sometimes hard to understand these terms in relation to each other because they don't necessarily fall into the same category. However, THC oil and CBD oil are cannabis oils, but particular cannabis oil may or may not be considered either. In other words, cannabis oil is an umbrella term for different specific oils. This has implications on what the oil is used for. As you can probably guess, THC oil isn't as applicable as CBD oils. So how does it help those suffering? Well, the people who take cannabis oil feel the effects of the cannabis itself through recreational use and medical use. It acts as a source of calmness and distraction from the leading cause, which then helps to minimize the production of seizures, pain, and anxiety, and altering ongoing symptoms. I will now begin to talk about the 3 medical conditions that help reduce the effects of seizures, pain, anxiety from the use of cannabis oils. Anxiety is a well-known stressor among individuals. The common issue includes clinical anxiety issues like social anxiety, PTSD, and OCD. Additionally, common types of anxiety such as sleepless nights, tight due dates, and maybe even fearing heights. In addition to that, many people are prescribed anti-anxiety meds that have numerous symptoms that link to it. In contrast to that, CBD has little to no relation to aid patients with all the typical side effects that anxiety brings, such as dismissive thoughts, sleepless nights, and trouble being around individuals. CBD interferes with the body's own natural system, also known as ECS. The ECS is available in about every cell in the body and manages many of the body's capacities, which include appetite, memory, sleep, mood, and our perception of pain. So how does CBD help with anxiety? It helps as a source of calmness. It provides a more natural alternative. It helps to relieve anxious behavior. It also provides comfort. In addition to this, data from statistics have demonstrated that CBD oil and anxiety are amongst the most explored subjects on the web. This is as far as cannabis-related treatments and medicines that are considered. A particular study on CBD oil for anxiety has soared over the previous years. This is present-day evidence that traditional cannabis treatments are starting to rise, and in fact, numerous individuals are, as of now, receiving the rewards of the hemp-based compound, in which helps counteract their struggle with anxiety. Cannabidiol, most commonly known as CBD, is the second most well-researched. CBD is showing promising regards to helping epilepsy, cancer, and anxiety. CBD helps patients seek relief from anxiety, inflammation, seizures, and other widely spread conditions. The use of cannabis oil for cancer patients has been gaining popularity on the worldwide scale, but studies have also demonstrated the positive effects it has on the disease as well, including epilepsy, anxiety, and those suffering from chronic pain. So how can cannabis oil help? Cannabis oil can help you if you are that cancer patient who doesn't take "we have done all that we can do" to heart, but instead look for an alternative method, or maybe you aren't convinced that Western medicine practices are right for you. With safe, high-quality cannabis oil, you're providing yourself with improvements in your well-being and your standard of living regards to managing your pain. So how does CBD kill the cancer cells? Simply when the THC connects to the CB1 or CB2 receptor site on the cancer cell. It then induces and increases in ceramide synthesis that leads to cell death. A normal cell does not produce ceramide when it is near THC. Therefore, it is not affected by the cancer cell. Through CBD is formed from the marijuana plant, in which it does not induce state of intoxication, given the high, which instead is causing the cannabis compound called THC, which is reducing the production of seizures. A seizure study has tested in 3 randomized double-blinded control trials, which revealed that the drug, when taken, in contrast to the other medication, was effective in reducing the frequency of seizures in patients. With the given potential side effects and risks that also rise from, or which include fatigue, decreased appetite, diarrhea, weakness, poor sleep, and infection. These symptoms were altered in the use of the oil. The CBD oil has altered top ingredients to help various medical conditions, but the most important form was alteration of seizures. The oil has helped many adults and children in bettering their seizures. The oil has helped reduce the production of seizures and control them. This oil has helped bring an alternative method in helping suffering children. Unfortunately, medical marijuana research is still examining the lasting effects of cannabis oil. Marijuana usage on these 3 areas, and its verdict is that short-term benefits still exist, but the long-term effects are still undergoing. To keep symptoms in reduction of individuals suffering the benefits they are looking for. Although it is not a curing mechanism, it does have its benefits, especially for those suffering from anxiety, seizures, and chronic pain.